More than 2,000 St. Vincent Mercy health workers are planning to strike if an agreement is not reached. Amy Steigerwald spoke with both sides at the center of this all, Mercy Health and the UAW. She's live tonight with details on the issues that led up to this planned strike. Amy.
Yeah, Andrew, negotiations have been going on since late July, but ultimately, if an agreement is not reached by 4:30 on Monday, thousands of nurses and other workers will walk out of this hospital. After months of negotiations, St. Vincent Mercy health workers issued a strike notice for Monday at 4:30 p.m. Ultimately, St. Vincent workers are upset with their proposed health care coverage, a changing hospital environment, and they feel they are overworked.
We have to have decent health care. We provide health care. We should get decent health care in return.
Workers say oftentimes they are working too many hours and are on call more often than they should be. Complaints also include feeling uncomfortable in the work environment since it's changing global ownership. Additionally, the UAW says the workers' health care coverage is not what they consider to be an acceptable package.
We can't get a decent health care plan for the people who administer health care all day long.
Mercy Health officials tell me they believe they have put a competitive proposal on the table. In the 56 negotiating sessions they've had, they feel as if the UAW's message is unclear and constantly changing.
We believe that it was competitive for a couple of reasons. One, because we were assured by the UAW leadership that it was competitive. And two, because we spend a lot of resources going out and surveying the community in our region.
Since the strike was issued, Mercy Health officials say they have set up meetings with the UAW to try and seek solutions. They claim the UAW has canceled those meetings, leaving them frustrated. However, UAW leaders say they never walked away from any negotiations.
We absolutely will continue the discussion. If they have a solution, by all means, send it to our negotiator. Let's figure this out before Monday at 4:30. We'd love to do that. We don't want to strike. That is not something that anyone is interested in doing. However, they dropped a 10-day strike notice on us. That forces us to start to prepare for the reality that at Monday at 4:30, they are going to be on strike.
We are 2.5 hours into a strike involving more than 2,000 medical workers. Right now, picketers are on the street chanting and cheering against their employer at Mercy Health St. Vincent Medical Center. Amy Steigerwald is live with the latest. Amy?
You said it right, Dan. All the protesters have been here since just about 4:30 in the afternoon. They walked out of the hospital and were met by members of the UAW that walked down from the local 12. I'm going to step out of the frame just so you can take a look at all the people that are here. The strike is in full swing. People have lined both sides of Cherry Street chanting in support of the St. Vincent workers. Now, how is the hospital operating right now? Well, Mercy officials say they are receiving support from their sister facilities to continue to run as normal. However, many nurses and even patients have been speaking out on social media and actually coming up to me here saying surgeries have been canceled and units have been consolidated, which is not the way a hospital normally runs. I asked Mercy Health officials about that, and they tell me they have adjusted their schedule, but do not attribute any cancellations to this strike. Now, this morning, the UAW announced they have filed charges against the hospital for urging employees not to participate in the strike that's going on right now, and for forcing those who are striking to use their vacation time. Hospital officials say no employee will be penalized for participating in this strike, and they are welcome to take their jobs back at any point. But many St. Vincent workers feel as if they are being ignored.
I've been here for 46 years, and I guess I'm just appalled at the disrespect and mistreatment that we're getting. We can't keep our patients safe. We can't protect our own nursing license, and it's very overwhelming.
But what they have to look at is they can't provide care without the human beings that are essential to that care. And we've got to care for the people who are caring for the people.
We may have moved some things back in the schedule, or if there's a sister facility that can help us out, have worked with our sister facilities. Again, things that we would do potentially depending on circumstances, even if we weren't having a strike.
Now we are going to continue to stay covering this strike throughout the night. We will have continuing team coverage tonight coming up at 10 and 11. Reporting at St. Vincent's Hospital, Amy Steigerwald, WTOL 11 on Fox 36. Yeah, Christy, St. Vincent workers and members of the UAW have been here since 4:30 yesterday afternoon. They are continuing to hold their ground right here on Cherry Street, lining both sides of the street and stretching down a little further, not as far as yesterday, but still taking up a decent amount of space here. You will notice them and hear them as you drive by this area. Cars are also still honking their horns, as you can hear, as they drive by. Now, in terms of negotiations, I'm told nothing has happened or even been brought to the table since the strike began. Now, the hospital telling me they are willing to speak with the UAW, but it's unclear whether or not that will happen. Now, this morning, the UAW called out Mercy Health for spending money to put their name on a sports complex in Cincinnati. The union is arguing that money could have been invested in supporting the hospital staff. As far as the hospital goes, they continue to say they are running as normal with replacement staff beginning to get the hang of things. But those who are on strike claim that is not what they saw leading up to this walkout.
We will continue to open units as we do more procedures, but the care is still the same high quality care that we give and our patients expect.
What we saw is that they were scrambling, that there were not enough respiratory therapists, there were not enough nurses, they were moving babies out, they were moving patients out, so I don't think they were as prepared as what they told us they were.
Now, with no meeting set between either of the groups, it's unclear when all of this will end, but we will continue to stay on top of things and bring you updates as soon as they come in. Reporting at St. Vincent's Hospital, Amy Steigerwald, WTOL 11.
New developments in the strike against Mercy Health. For 11 days, we've heard from hospital officials, union leaders, and countless people on strike. But tonight, we have spoken exclusively to a nurse who's been crossing the picket line to provide for the family. Amy Steigerwald met this nurse and joins us now. Amy.
Well, the nurse I spoke to tells me the reason they chose to stay inside the hospital was ultimately to get a paycheck and provide for themselves. The nurse is remaining anonymous for protection. Right now, St. Vincent healthcare workers are standing their ground outside the hospital, but some nurses on the inside describe having mixed emotions. We spoke with one who is remaining anonymous. Despite not walking out, this nurse says they have friends on both sides and ultimately respects and agrees with why people are striking.
I think the issue with the contract was on-call time, which is a big deal, yes, and the healthcare.
Leading up to this strike, this nurse says they were terrified. They describe some coworkers walking out and some staying behind, not knowing how or if Mercy or the union would punish each side.
So I was terrified, and also my team isn't there, so I was just so scared. But I don't know what the penalty is. I don't know what I'm going to face, but I know that I'm working and paying my bills right now.
The nurse also says they stayed behind because of miscommunication from both the UAW and Mercy Health. This nurse claims they are a member of the union and never saw Mercy's final offer because the union did not show nurses that contract. I asked the union about that. They tell me their nursing chair did not find that contract acceptable to show members because it was not different from what Mercy had offered previously.
I'm an adult. I am an adult enough to work full-time hours. I'm an adult enough to be a registered nurse. So why am I not adult enough to make the decision of whether or not I want to agree with the contract?
As far as what's going on inside the hospital right now, this nurse says conditions are safe but far from normal.
We didn't know what was going to happen, so yes, NICU babies got transferred out. Yes, they condensed the ICUs. The ICUs weren't shut down, they were condensed.
Right now, this nurse wants an agreement to be reached. They are concerned what's going on outside the hospital with honking horns and cheering is negatively affecting what's going on inside the hospital.
You say you're striking for patient safety and because you care so much about the patients, but then you're encouraging this behavior that is disturbing all the patients.
And if you drive by this hospital, you can hear that honking and that chanting. To see that full interview, visit our free WTOL 11 app. Reporting outside St. Vincent Hospital tonight, Amy Steigerwald, WTOL 11.
Toledo Police investigate.
Well, Andrew, after 3 days of negotiations, these workers here on the picket line are pretty much back to square one. A lot was discussed at those meetings, I'm told, but right now this strike is at an impasse. Now, Mercy Health released a statement this afternoon explaining their end of the deal. They claim they tried to work out an agreement with UAW leaders by offering more specific solutions to the areas these striking workers are concerned with. So specifically the areas of on-call hours and health care, which is what we've been talking about since day one. Now, a few of Mercy's solutions included reducing on-call hours by 10% over an 18-month period and limiting health plan out-of-pocket maximums and deductibles to remain the same for the next 2 years. Now, the UAW side, they say they were willing to accept that offer, but asked Mercy to increase the hourly rate for those on-call hours if that 10% benchmark was not achieved in 18 months as promised. Union leaders say doing this was a way for them to ensure Mercy kept its promise to these St. Vincent workers. Now, the hospital says they presented fair proposals and solutions to the issues identified by the UAW, and if the union could not recommend that offer to striking workers, that offer would no longer stand. So as a result, the offer on the table right now is Mercy's last, best, and final offer, which was ultimately what was on the table last month. Workers are still holding their ground here on the picket line despite no end being in sight.
We all have licenses we need to protect. Mercy's not going to willing to protect it, so we need to, and we're going to stand on the line until we get some resolution from them.
We could work anywhere. There are lots of places that we could work for more money. I could go up to U of M. I could take care of kids there all the time. We're here because we want to work for the hometown. We want to take care of the people in our own communities.
And while all those St. Vincent workers that I spoke with outside the Union Hall tell me they plan to hold their ground here on Cherry Street, ultimately some of them have resorted to looking for other jobs at this point. We will continue to stay on top of this and bring you developments as they come into our newsroom. Reporting live outside St. Vincent Hospital, Amy Steigerwald, WTOL 11.
Ohio Senator.
We can't get a decent health care plan for the people who administer health care all day long.
It's been more than a month since thousands of Mercy health workers began to strike.
I love this facility, I love the staff, I love the nurses, but they are drowning and they really do need help.
But today, on day 38, a tentative deal between Mercy Health and the UAW.
I'm very excited to go back to work. I can't wait to see some of my favorite patients.
Toledo's news leader talking with nurses as they get ready to step back into the hospital.
Tonight, Mercy Health St. Vincent nurses no longer on the picket line. The UAW says they have reached a tentative agreement with Mercy, which addresses many of the nurses' major concerns. Amy Steigerwald has been on top of this strike since before it even began. She joins us live outside St. Vincent's to explain what happens next. Amy.
Well, Christy, it is quiet. It is empty here on the former picket line, I should say, outside St. Vincent Hospital. But nurses will not be going back to work at this hospital just yet. Despite the strike ending this afternoon, a vote still needs to happen. Now, nurses packed up the picket line just around 3 o'clock this afternoon after being told there was a tentative agreement on the table. Despite the strike ending, the nurses still must vote and approve that new agreement. We do not know what that contract specifically looks like, but the UAW says it addresses many of the nurses' major concerns that they've been asking and talking about since day one. Now, I'm told that vote will happen tomorrow and Friday. So Thursday and Friday of this week, the nurses will sit down and ultimately approve or reject that new contract. Now, if it is approved, the union will then work with Mercy to get them back to work. So the nurses cannot just immediately go back to work at the hospital. There is a protocol that each side must follow that's a little different from when the technical and service units went back to work just a little under 2 weeks ago. Now, I spoke with many nurses here over the past 38 days. Some of them did not know if this would end, but they also tell me they have grown closer with their fellow nurses because of this experience.
Very excited, very happy. It's been eye-opening, and it's been great to see the camaraderie that I have with my fellow nurses, some of which I never even met until this happened.
Now, Mercy Health says they're excited to welcome their nurses back to work and are happy that they will be voting on this new contract. Again, that vote happening tomorrow and Friday. We will be on top of it and bring you the latest. Reporting live outside St. Vincent Hospital, Amy Steigerwald, WTOL 11.